Gracias por acompañarnos a una conversación muy importante sobre el impacto del COVID-19 en la comunidad latina. Les saluda Steve Downing de Telemundo Kansas City y tengo conmigo a 3 invitados especiales, quienes compartirán sus pensamientos y consejos expertos con la meta de crear conciencia acerca de este tema. Dr. Marvia Jones is the Division Manager for Community and Family Health Education with Kansas City Health Department. As a community behavioral psychologist and public health professional, she is passionate about supporting behavioral health and resilience among individuals and communities. It's a pleasure to have us with you, Dr. Jones. We have Dr. Eliseo Perez Estable. He is the Director of the National Institute on Minority Health and Health Disparities at the National Institutes of Health. Dr. Perez Estable is recognized as a leader in Latino healthcare and disparities research centered on improving the health of racial and ethnic minorities and underserved populations. Dr. Perez Estable, it is also great to have you with us.
Thank you.
Congressman Emanuel Cleaver II is now serving in his 9th term representing Missouri's 5th Congressional District. He is a member of the Committee on Financial Services, a member of the Select Committee on the Modernization of Congress, and a member of the Congressional Black Caucus, among other committees and subcommittees. It's an honor to have you with us.
Good to be here.
Nationwide, Hispanics have had vast disparities in COVID-19 transmission, hospitalization, and death rates compared to any other racial group. While the vaccine rollout is recent, we are also seeing data showing that Hispanics are more hesitant in receiving the COVID-19 vaccine than non-Hispanics. We want to understand why this is the case and learn how this disparity gap in health conditions and healthcare can be reduced. To start off, Congressman Cleaver, why is it important for you to be here and have this conversation?
Well, in the middle of a pandemic, and this is the only one that we have experienced during our lifetime, there is always going to be a high level of paranoia. People will have some reservations about their government because anytime you have a group that is experiencing any level of discrimination, any level of organized hostility, they're going to be a little resistant to somebody saying, hey, I have a needle and I can help you. And so I think that as a member of Congress who has been involved in trying to get as much money put into this program as possible so that we could go after every group, particularly those who have a hesitancy. I am here because I want to make sure people understand that there are those of us who also experience paranoia and who are looking at almost every single stat that we can find to make sure that there is no discrimination, that there is no exclusion, and maybe more importantly, there is no subplot. There is no design to do things to a group of minority individuals. You know, when you look at something that allegedly happened on the border where there were people coming into the United States from Mexico, but probably from Central America, and a report that many of the women, actually against their own will and knowledge, were given hysterectomies. That creates the level of hesitancy and outright anger over people saying you need to take the shot. So we want to say government works. And there are those of us in government, perhaps the majority now, who understand that we've got to do everything we can to erase a lot of the negative history.
Thank you, Congressman. Dr. Perez Estable, the disparities do exist nationwide. What is the national discussion at this time around trying to bridge this gap?
Well, I want to highlight that it's now been 14 months since we really began to experience the pandemic in this country. And this disparity was observed early on, initially in the dense urban environments in the East, among African Americans first and subsequently Latinos, and other groups, American Indians in the reservation and Pacific Islanders. And for the Latino Hispanic community and the other minority communities, this disparity has not gone away. So we've known about it for 14 months. We have not been able to stem the tide, because the virus is still being transmitted at unacceptable rates. Now, we're much better off than we were in January, but still 50,000 cases a day, 600 deaths a day, and 40,000 people hospitalized is not success. We have to keep pushing on this. So the vaccination campaign has been, in my view, an enormous accomplishment so far, but we're not done yet. A little over 50% of the country is immunized with at least one shot. We need to get closer to that 70, 80%. Yes, 20, 30% of the community is hesitant, but we think we can get close to that maximum number. And among Latinos, the hesitancy has generally been similar to whites. Lately, there's been a slight uptick, and I think this kind of programming will help with that. So I'm really delighted that you're doing this as part of this network. So,
thank you, Doctor. And there are those barriers, as Dr. Perestable mentioned, as well. Some of the research shows that the lag in Hispanics receiving the vaccine is also attributed to a language barrier, also misinformation and disinformation. Dr. Jones, are there other specific obstacles you have seen in the Kansas City area that is impeding our progress to vaccinate people, which may be causing the 5th Congressional District to lag behind others?
Yes, thank you. I think that's an important question, and I know from the Kansas City Health Department perspective, we think about access and we think about attitude. And so when we think about access, we're thinking about the times of day when clinics are being made available. We know that a lot of people work, and they may be working a non-traditional, or it is a traditional schedule, but they are not working in a way that a 9 to 5 sort of clinic would meet their needs. And so we know that we need to expand those hours, and throughout the community we have been doing that. We know that there are also concerns about needing an ID, cost, people thinking they might need insurance or there's some sort of fee for the vaccine. We want to make it clear that that is not the case. I think there was maybe some confusion at some point wherein when people were getting tested, they started asking, okay, put down whether you have insurance and what your insurance is. And so all of those little small things lead to some of the confusion around what is actually necessary in order to obtain this. And then finally, we know that as we talk about, even though some of the initial communications might have been translated into Spanish, we know that some of the other updates, as information gets updated, through this whole pandemic, we've kind of improved our understanding of the pandemic and the response necessary throughout. And some of those updates may have not been conveyed properly. So you have some people who believe that because they've been previously infected with COVID-19, that they are, fine, I don't need the vaccine. And we know since the prevalence of infection had been so high, a lot of people probably think that, and we want to let people know that that is not the case, that you are not necessarily protected because you've had a prior infection.
Back to you, Dr. Perestable. How much of the vaccination disparities among Latinos do you believe can be attributed to these call them traditional barriers? And then how can local health administrators like Dr. Jones can combat those disparities?
So based on the data that we have seen and experienced, there are many barriers that exist in all communities. People are worried about it. Is it safe? Does it work? Wasn't this done too quickly? And those, I think, are really important to just be clear with facts. The efficacy of the vaccine in a randomized trial where we have the best possible methodology is 90 to 95%, and in real world effectiveness, it holds up. So this is terrific results. This is like as good as the measles vaccine is for children. Is it safe? And in both the 2 messenger RNA platform vaccines, the Pfizer and the Moderna vaccine, the safety profile is really outstanding when you consider how many millions of people have received them. There are some potential rare serious side effects, severe allergies, and of course, painful arm and some systemic symptoms, but it's really a very good safety profile. And then the third issue is, how did they do it so fast? And the answer to that is that it was the result of years of hard work of basic science. The scientists at NIH and other places had been working on this model platform in response to prior respiratory virus epidemics. There was a SARS epidemic in early 2000s, another one in late 2000s, not nearly at this dimension, of course, but still it facilitated development of this science. So the speed of development really is the product of basic work that had gone into it. And they were ready to go as soon as they had the sequence of the vaccine. The standard barriers Latinos have, are they going to deport me if they're undocumented? Do I need insurance? I don't have health insurance. Well, vaccine is free. Yes, you need an ID because, like we do any medical care, you need to show that it's the person that's going to get the vaccine. It's a standard practice. It could be your passport. It could be any ID. And no, health insurance is not necessary to get the vaccine. It's completely free. And so those are important to repeat and make sure everyone's aware that anyone can get the vaccine for free.
Thank you, Doctor. Congressman Cleaver, what efforts are the city, state, and federal government taking to reduce the language and technology barriers?
Well, one is to reach out to the media and trying to transmit as much information as possible in the second language of some and some who might otherwise not completely understand English or may misunderstand English. And I think that, you know, the government, we say that the vaccine is free. The truth is it's not free. And none of the work that's being done is free. What I think we need to say is that the government is assuming all of the costs for all of the vaccines and all of the efforts to get this vaccine into the arms of Americans or people who are living in the United States. And then I think the president has just said that if we can reach herd immunity here, then we reach out to India and other hotspots around the globe. I think the government can work. One of the things I'm hoping that we have learned in this battle is that government can work. And I think over the last few years, with some intentionality, people have tried to give the image of our government that it just can't work, it can't do anything. And I think that's been slowly torn away with the successes we've had. Now we're still a long way, have a long way to travel before we can say we're out of the woods on this issue. But we're trying to get through to not only the young people, which the president has spoken to earlier today, but to the elderly folk as well. The president went on television and in an attempt to reach younger people, 16 years and older, who can now take the vaccine. And he has asked, which I will ask, if you're 16 years of older, if you input your zip code at www.vaccine.go or Vacuna, VACUNA 822-862 to get help in setting up an appointment at a nearby location. That's what I think government can do, and I'm proud that we are doing it infinitely better than we were doing it at this time last year.
Thank you, Congressman. And that tool is out and available now, as Congressman Cleaver said, vaccines.gov, or in Spanish with vacunas.gov. And you could also text Get Vax in English to 438-829, or in Spanish, Vacuna to 822-862. So there's also a problem surrounding the lack of data and slow reporting on ethnicity. There is no race ethnicity reported at the state level, and at the district level, data is provided for only a third of vaccine recipients. Dr. Jones, what is the role of local health departments in collecting that data, and what can the state do better to inform local health departments of the racial and ethnic backgrounds of getting people these vaccines?
No, that's definitely something we're grappling with right now. So the role of the local health department is to basically encourage all of the different people, what we call the vaccinators, to let them know that this data is important to us. For all of the clinics that we hold, so every event where we are the vaccinator, we now collect those data. However, what we need the state to come in and do, because the state distributes the vaccines for people to inject. So we need the state to say, hey, you must collect this data, and then start making it a standard process. Right now, that is not the case. So the state does not require that, and we need them to do that, and we have been advocating for that strongly throughout this pandemic.
Great. Staying with you, Dr. Jones, the smaller counties in the 5th Congressional District are receiving vaccinations at a similar or higher rate than those larger counties like Jackson and Clay. Is there a reason for the more equal instead of more equitable vaccine distribution?
Yeah, so from our standpoint, from a public health standpoint, you always want to go with the equity route. So the equity route would say that even though numbers-wise you're going by population, we know that the need is greater in some of these locations that you've listed, like Jackson and Clay County, because of the populations that we have. So because we've already identified certain risk factors that make certain groups at higher risk, we should be working faster. The faster we can build those groups' herd immunity, the faster we can all have it. So here, equity is definitely more important than just going by a population ratio. So,
great. Thank you, Dr. Jones. Dr. Perez-Stable, are you aware of any unique difficulties vaccinating minorities in rural areas that do not exist in urban areas?
Oh, there are many barriers in rural areas. I mean, just being isolated and more remote, if you consider just from a technical point, the vaccines, the messenger RNA vaccines need a cold chain. So they need to be stored in -20 for one, and even deeper, more cold refrigerating for the Pfizer. And so unless you know you're going to use all the vials, you can't, it's wasting to go to an isolated area. This is one of the big advantages of the one-dose Johnson & Johnson vaccine. It can be stored very easily in any refrigerator. It lasts for several months, and it's one dose. So I think that the vaccine works. I'm pleased that the pause was lifted, and the safety profile is certainly adequate to continue to strongly recommend it. There are other barriers. I mean, are there workers to administer the vaccine in isolated areas? I was talking with a group of agricultural workers probably about a month ago, related to actually one of your colleagues from Congress, Representative Cleaver, and there were issues about, well, let's bring a mobile van to the farm workers, to the agricultural community in the Imperial Valley in California, for example. And I think as we get closer to more and more people getting fully vaccinated, we have to become creative, innovative, and assertive about how we get more needles into arms with this vaccine, which is really our only true effective weapon to control this pandemic. Other than the behavioral changes which are really hard to sustain and aren't going to be as effective as getting every vaccine into everyone. So absolutely, rural areas need to be a priority. It's 20% of America. So,
thank you, Doctor. And as we know, the high concentration of Hispanics in those rural communities, whether they're in the agriculture industry or the meat packing industry. So an important dynamic there. Congressman Cleaver, staying with the rural communities, how do you convince them about the importance of getting vaccinated as a whole when many of these areas have never had an enforced mask mandate or shut down during the pandemic?
Well, contrary to what a lot of people think, the 5th District, which I represent, has a huge rural component. For people who are around in the Kansas City area, that you can relate to what I'm about to say. It goes from Excelsior Springs and northward all the way to a few miles from Columbia, Missouri. We're talking over 100 miles. And in that area, there are actually one large hospital and one little clinic, and then one little small hospital. And so it's difficult for the kind of aggressiveness that we need to reach people in the rural areas about this deadly virus. However, I do think that there are things that we can do. For example, in one of my little towns, Marshall, Missouri, there's a huge meat packing plant. I've been in the plant, and I was able to see that almost none of the people who were in there working spoke English. If we are going to value all workers in this country, then it means that we're going to do whatever it takes to communicate with those workers who cannot speak English. The same thing, we have a huge Apple industry. Most people don't know that in the 5th District. And migrant workers come in. We need to have people ready there and waiting when they come in, people who can speak the language, people who in whom there can be some trust placed. I think that's the only way we're going to keep this under, get this under any kind of control.
Thank you, Congressman. Back to you, Dr. Perez-Stable. Some groups around Missouri have begun dispensing vaccine information in Spanish. We've been fortunate to work with a lot of these groups in the metro area and holding these vaccination events focused on the Latino community. How important are these events for getting them open to vaccinations?
Well, I think all of these activities are important, including this forum. There are many people who were eager to get the vaccine, and we saw that early on with the demand overwhelming the supply. We're now reaching the point where the supply is going to exceed the demand pretty soon, and we have to work hard now at proactively getting more people who, they may say, well, I'm not so sure. But if we create the opportunity and say, let's go to the clinic and the nurse offers the vaccine, maybe they'll get it right there. They'll just not think about it. They make a qualitative in the spur of the moment because they're not adamant about being against vaccine. They're just hesitant, and we really have to work. This is a cognitive and behavioral approach that is effective for many of these things. And if you do this in the community, whether it be your pastor, your minister, related to a church event, or a community organization, or linked to some other activity that is allowed and safe, I think that this can be an effective way to reach out. The other is local champions. I mean, having your local health department leaders, your local doctor, your local community leaders, faith-based leaders, really be out there promoting it. That is by far the most effective spokesperson for this. Dr. Fauci, of course, is great, and if we can get him, we always will. But it's not you got to get a celebrity or it's really the local leaders that matter the most.
For all those that are watching us, we have an opportunity for you to access a vaccine, and that is this Saturday, May 15th, from 9 a.m. to 2 p.m. at the Mattie Road Center. And that's in partnership with the Hispanic Chamber of Commerce, the Kansas City, Missouri Fire Department, and the Missouri National Guard. And like this event, there are many others in the Kansas City area and surroundings put together by these great organizations, as Dr. Perez-Stable said, these champions in the community. And so we invite you all to seek these opportunities for receiving a vaccine. I want to give everyone an opportunity to give us some final thoughts, including how to put these ideas into action. And what can city, state, government, and what can we do as a whole to all work together towards bridging the disparity gap within the Hispanic community. Dr. Jones, I'll start with you. Any final thoughts?
Yes, I would, other than reiterating the fact that this is one of our single most important methods of getting back to some sort of normal, I just encourage everyone to seek out the vaccine. And I also, my takeaway here is I really like what Dr. Perez-Stable said about using more of the local champions. And so that's something that I know the Kansas City Health Department will lean more into, identifying those healthcare providers and other community champions that will really be encouraging.
Great, thank you, Dr. Jones, for your insight and thoughts there. Dr. Perez-Stable, I'll go with you. Final thoughts.
I'll share 3 points. One is for the community in general, no question is a dumb question. Ask whatever you hear or read about that somebody said. A lot of people are saying things that sound science fiction to us scientists, but ask us, because we need to answer everything with the facts. This is science. We're not going to tell you stories that aren't true. Second, if you don't think that you have to worry about the vaccine because you don't think you're going to get COVID, do it for your loved ones. If you're young and healthy and you say, I get COVID, no big deal, I'll get over it. Well, do it for your grandma or do it for your kids. Make sure that in case you do get so sick, that we will be able to see them grow up. And I think this is another important, really important message that we need to continue. And then inform yourself. Read science-based or vetted information, whether it comes from your health department or from the Centers for Disease Control and Prevention or the NIH, or ask your local experts. Don't just take that rumor that flies through social media or that, oh, you heard someone say this or you heard someone say that. Really get the facts, and that way you'll be able to make a decision for yourself. This is voluntary. No one can force you, and we're doing it not just for our own individual good, but for the common good. Because the events of this past year, as everyone has acknowledged, are unparalleled, and we hope never have to go through this kind of pandemic again.
Great. Thank you, Dr. Perez-Stable, for giving us your thoughts and your perspective at the national level as well. Congressman Cleaver, we'll end with you. Any final thoughts?
2 things quickly. One, sometimes we hurt ourselves out of something that is actually beautiful in our culture. The 2 groups of Americans who are always undercounted in the census, Black and brown people. You know why? Because they are, we are not really anxious to give out information. How many people live in your house? They're trying to get ready to raise our rent, or they're getting ready to do something to us. It's not, so we are undercounted, in the census every single 10 years. And I can tell you we're going to be undercounted when this next census comes through. And a beautiful part of that is that and I think Hispanic Latinos more so than African Americans we possess this beautiful cultural characteristic that allows us to be generationally connected. And so it's nothing to see somebody when my family decided to leave a little town in Texas to move up to another larger town in Texas. We went up and stayed with our aunts and uncles, and there probably were 14 people in one house. The same thing with Hispanic Latinos, and even though I think that's beautiful, it also creates problems because we can easily infect the older members of our family out of this generational love we have. I'll end by saying my brother-in-law said he didn't want to take the vaccine. So I don't believe in it. I think it's terrible. And so I said, okay, I can handle you saying you're not going to take it. But your mother's in the living room right now, and she is 94 years old. Take the vaccine for your mother. Take it for your mother. I think that kind of thing finally got through to him. But I think we've got to do every single thing we can think of to get people to take this vaccine. We've got to kill it, and it is not easy to kill. It's waiting out there for people every single day. But we can destroy it. We're some destroying vaccine people.
Thank you, Congressman Cleaver. Quisiera agradecer a todos nuestros invitados, la doctora Jones, el doctor Perez-Stable y el congresista Cleaver, por su preocupación y por compartir su conocimiento y ofrecer sus consejos a nuestra comunidad. También damos las gracias a la Cámara de Comercio Hispana y por ser nuestros anfitriones. Agradecemos su apoyo a nuestra comunidad hispana. Esperamos que haya sido de beneficio para ustedes. Soy Steve Downing con Telemundo Kansas City. Gracias por su atención.